I'm going to talk about a case study on Mr. and Mrs. A. Mr. A was the sole carer for his wife, Mrs. A, who had severe physical disabilities and relied on a wheelchair. She could walk only a couple of unsteady steps at a time, had very little movement in her hands. She was still being treated for skin cancer after 11 operations. Her speech was severely impaired, and only her husband could understand what she was saying. Mr. A had given up his job 18 years earlier to become his wife's full-time carer. Mrs. A was now reliant on her husband for all her personal care needs, including eating, personal hygiene, and transferring from one place to another. Mr. A had had the support from a carer's advocate for a number of years. 2 years earlier, with the carer's advocate support, he and his wife had applied for, but had been refused, a direct payment for his wife to pay him as her personal assistant. Adult Services had not explained why this application had been rejected. Mr. and Mrs. A had found the whole experience so stressful that they decided not to appeal. They continued to experience financial hardship, however, and had discussed the need for Mr. A to return to work. When Mr. A found that there was a specialist advocate who could support him and his wife through the process of applying for a personal budget, he asked his advocate, who went on to introduce them to the specialist advocate, to make inquiries. He and his wife decided they would consider challenging the earlier direct payment decision. The advocate was able to establish the history of the case. It was agreed what they were trying to achieve and to keep the carer's advocate up to date. The specialist advocate explained her role and received consent from Mrs. A to act on her behalf and to involve her husband in the proceedings. Mrs. A, who had capacity to make her own decisions, was happy with this arrangement. Mr. A was categorically stated that if the application was going to be unsuccessful, he did not want him and his wife to go through the same experience and ordeal as before. And this is when the advocate went back to check the information and said that she would report back if there was any difference. The specialist advocate researched the scope for a close relative living in the same household to be employed as a personal assistant. She got a copy of the eligibility criteria, sought advice from Community Legal Service, and talked to the local authorities' direct payment support service. She explained to Mr. and Mrs. A that the criteria indicated that direct payments could be paid to a close relative where there were communication difficulties. She then went on to try to find out why Mr. and Mrs. A had previously been refused. At this point, it became difficult to get the case reopened. The advocate found senior managers in adult services reluctant to provide the information she required. They were unfriendly and unhelpful. They would not reopen the case and said there was no evidence of a change in circumstances since the earlier assessment. The advocate met Mr. and Mrs. A. She found that there had been major changes. Previously, Mrs. A's parent had helped substantially with her care, but her father now needed support from his wife following major surgery. Mrs. A's health had deteriorated since her parents had had to reduce their support. Relations with adult services deteriorated when they lodged a complaint with the advocacy service chief executive alleging that the advocate had not followed correct procedures. A full investigation was carried out which showed no evidence of any wrongdoing. She was asked to continue to support Mr. and Mrs. A. Relations with adult services remained difficult. Information about the earlier refusal was still withheld. Social workers kept repeating that the couple did not have a valid argument for the reassessment. In the course of these negotiations, Mr. and Mrs. A sometimes did not understand the rationale for the information requested by adult services. Some requests they found intrusive and an invasion of privacy, but with the advocate's support they began to see why some information might be important rather than designed to catch them out. However, Mr. A was repeatedly frustrated, and the advocate could see how his attitude might have been misinterpreted by adult services and could have exacerbated the situation. The advocate therefore began, while continuing her support to Mr. and Mrs. A, to work as a peacemaker and intermediary. For example, adult services suggested that input from a speech therapist might improve communications with Mrs. A. Mr. A was against it. He was anxious not to subject his wife to needless, exhausting tests, but in this he appeared obstructive to adult services. The advocate found evidence from an earlier speech therapy intervention, which indicated this would be unlikely to work. The speech impairment was the result of brain damage during an operation. Earlier notes from the GP, adult services themselves, and the district nurse all supported this. The advocate was then able to resolve the issue amicably. It took 18 months of intensive work before a satisfactory outcome was reached. During this time, the advocate had gathered information, carried out many home visits, supported the couple through Mrs. A's care assessments and independent living fund process, liaised with other organisations and professionals, and made use of legal support from Community Legal Service. Mrs. A was finally assessed as needing 72 hours of care each week. She was awarded a personal budget. Adult Services funded 32 hours of this, and the Independent Living Fund paid for the other 40 hours. The resulting direct payment enabled her to employ her husband as her personal assistant.